We have an increasing number of clients who come in that has both an autistic profile as well as an attention deficit type of profile. And there's even a term coming out that calls it AuADHD, as this combination is occurring more frequently than ever. There are multiple overlaps between autism and ADHD. Please do not lose the scope that they are quite different in the brain. Where ADHD is very dopamine reward centered in terms of gratification, in terms of even looking at things like intrinsic motivation to pay attention, to sustain that attention. Where autism is very pervasive in the brain. There are many areas of the brain, many neurohormonal interplays, especially the HPA axis when we're looking at stress and cortisol, looking at adrenaline, norepinephrine, looking at the size of the amygdala that we see as differences in autism. It may not always be that because they coincide that they can be helped by the same therapy. If I'm providing a stimulatory program, whether it's medicine or whether it is therapy to ADHD to support the dopamine reward, to get into what it's going to take to get them to sustain focus, that may not be a therapy that could be helpful for someone that is autistic, because sometimes stimulatory products could actually cause more blunted affect. And then what we really want for autistics is to flourish emotionally so that they can be social and to the best extent that they need to be, so they can fully be who they are. We need to think about this. We need to think about, if I see this as a combined diagnosis, what is my intervention plan? What am I focusing on? The developmental nature of an autistic profile will always lend itself to have to negotiate the attention mechanisms of the brain. Is it a natural outcome of a developmental piece, or is it attention deficit disorder? We need to think on this.